Bismillahirrahmanirrahim. Quote of the day: Modesty is the part of faith. Sahih Bukhari. Today, the topic of presentation is basic types of research and thinking paradigm. I am Dr. Rabbia Iqbal, PGR, Community Medicine. I am presenting under the supervision of Professor Dr. Saira Afzal, IPS Lahore. Learning objectives. By the end of this presentation, participant will be able to define research and describe the health research triangle, distinguish between empirical, theoretical, basic, applied, quantitative, and qualitative research, compare positivist and non-positivist transformative research paradigm, explain deductive and inductive reasoning with example, and Mill's canon of induction to epidemiological scenario. So now we come to the topic: what is research? A systematic, scientific, and organized process of investigating a problem to generate new knowledge, verify existing knowledge, or solve practical problems. So in this, we collect data via experiment, survey, or observation, and then we analyze by applying statistical or qualitative method to the data, and then interpret, draw conclusion, and generate new knowledge. So this is a triangle in which biomedical research, health service research, and behavioral research. So all three must be considered in formulating research policy. Next is basic types of research. Uh, these are the types include empirical, which is based on observation and experiment; theoretical, which is based on concept, model, and framework; basic research, which include knowledge for its own sake; applied, solving specific problems; qualitative and quantitative research. Uh, First one is the empirical research, which is based on real world observation and measurement. So the key characteristics include uses real world observation, data via survey, experiment, and measurement. Findings are verifiable and reproducible. Statistical analysis commonly used. So the steps include observation, hypothesis, data collection, analysis, and then conclusion. Example, a researcher measure blood pressure in a 500 adult to determine the prevalence of hypertension. So the advantages of empirical research is produce objective, verifiable evidence useful for policy making. Second one is the theoretical research, which is developing, refining, expanding theories without necessarily collecting field data. So the characteristics of theoretical research are focus on ideas and concepts, generate new hypotheses, may use mathematical models, foundation of empirical research. Advantages of theoretical research are expands scientific understanding, explain observed phenomena, generate future research questions. For example, developing a conceptual framework explaining the relationship between climate change and vector-borne diseases. Next, the basic, the pure research, which is curiosity-driven, expand scientific knowledge, long-term indirect benefit, limited immediate practical use, often expensive and time-consuming. For example, studying genetic mutation in a cancer cell, molecular biology of infectious diseases. Fourth one is the applied research, which is the problem-oriented, produce or actionable result, influence policies and programs. Immediate practical benefit may have limited generalizability. For example, evaluating a vaccine campaign, assessing a heat wave warning system. Fifth one is the quantitative research, which is numbers, statistics, and objective measurement. Common study design includes cross-sectional study, case control study, cohort, and randomized control study. So the data collection method includes surveys and questionnaire, laboratory measurement, clinical records. Advantages of quantitative research include generalized finding, objective result, allow hypothesis testing, and large sample size. Limitation includes limited understanding of human experiences. For example, determining prevalence of obesity among school children. Sixth one is the qualitative research: why and who, exploring experience, beliefs, and perception. So the characteristics include small sample size, flexible methodology, rich descriptive data, context-specific finding. It provides deep understanding, explore complex social issues. So the data collection method include in deep interviews, focus group discussion, participant observation, and document analysis. For example, barrier to the cervical cancer screening among women in Lahore. So this is a comparison between quantitative and qualitative. Quantitative is the numerical data used, whereas in qualitative, words and natives use. Quantitative, large sample size, whereas in qualitative, there are small sample size. Uh, Quantitative is a structured method, whereas qualitative is flexible and interpretive. The purpose of the quantitative is to measure and test, whereas qualitative is understand and explore. Reasoning include deductive reasoning in quantitative and inductive reasoning in qualitative. High generalizability in quantitative and low context specific in qualitative. Analysis include statistical analysis in quantitative and thematic and content based on qualitative. So the paradigm in positivist and interpretivist in qualitative. So next is what is paradigm? Worldwide are the philosophical framework that guide how research is conducted. So a paradigm influences what a researcher study, how data is collected, and how findings are interpreted. There are three main paradigm: positivist, non-positivist, and transformative. Positivist paradigm include reality exists independently and can be objectively measured. Key assumption include there is a single objective reality. Knowledge comes from observation. Research should be unbiased and objective. Scientific method produce valid knowledge. The research process include theory and then hypothesis, data collection, analysis, and then conclusion. Nature of the reality is objective. Research approach is quantitative. Independent researcher role is independent, and reason type deductive, data type numerical. For example, testing whether the cranberry supplement reduce recurrent UTI in children. Next is the non-positivist. Reality is socially constructed and may differ among individuals. Key assumption: multiple realities exist. Human experience are important. Meaning in constructed through interaction. Researcher is involved, not neutral. Key aspect include nature subjective, research approach qualitative, researcher's role involved, reasoning type inductive, data type words or narrative. So the process of the research is observation and then pattern, theme, and theory development. For example, exploring the perception of mother regarding the breastfeeding practices. Next is the transformative paradigm. Research should promote social justice and empower marginalized groups. It includes social justice, address inequality in social community participation, communities involved at every stage. Mixed method, combine qualitative and quantitative. Social change, knowledge must lead to action. For example, gender inequality in healthcare, assess community-based participation research in school, climate health adoption study. So this is the comparison of the positive, non-positivist, and transformative. Uh, uh, Positivist is a quantitative, non-positive is qualitative, whereas transformative is a mixed method. Perspective of the positivist is objective, non-positivist is subjective, and social justice in transformative. So the focus of positivist is scientific, humanistic in non-positivist, and transformative in marginalized group. Methodology that are used: experimentalist, interpretivist, and community-based. Reasoning, deductive in positivist, inductive in non-positivist, and both in transformative. So the goal include explanation in positivist, understanding in non-positivist, and social change in transformative. Next is the community-based research, participation research, a transformative research paradigm, bridge science and practice through the community engagement. So this is a comparison of community-based participation research and traditional research. Community-based participation research is a transformative methodology which are used are mixed, and it determine purpose, data collection, and generate result. Focus of the research include problem identify the community. Ownership include community plus researcher. And advantage of the community-based participation research, empowerment of the communities, advocacy, policy, and formulation. Whereas in traditional research, research paradigm is positivist or interpretivist methodology that are used qualitative or quantitative. Community involvement only used as a study subject. Focus of the research is problem identified by the researcher. Advantages of the traditional research is it is a scientific advancement. So next is the interference, reasoning, and change. Reasoning is the process of thinking logically used to make decision and solve problem. Seven type of reasoning in the research: deductive reasoning, inductive, abductive, backward induction, critical thinking, counterfactual, and intuition. The two main types that are used in research is deductive and inductive. So, deductive reasoning is the top-down logic, general theory to the specific conclusion. General theory and then hypothesis formation, observation and then data collection, confirmation and conclusion. Example, premise one is smoking lung cancer. Smoking causes lung cancer. Second premise is Ali smoke cigarette. So the conclusion of this is Ali has high, increased risk of lung cancer. So it associated with quantitative research, produce confirmatory evidence, test existing hypotheses, conclusion logically certain. Next is inductive reasoning, bottom-up logic, specific observation to general theory. So first is observation, then pattern recognized, and then generalizability, and then theory developed. For example, vaccine hesitancy. Observation of this is several month reports fear of side effect as a reason for vaccine refusal. Pattern, this is seen repeatedly across the interviews. Theory, fear of adverse effect is major determinant of vaccine hesitancy. So it produced exploratory finding associated with qualitative research. Conclusion is probable, not certain, generate new hypotheses. Next is a scientific based research include order, probability, hypothesis, reasoning. So order is the observation are classified in order before analysis based or commonly of the property. Scientific method employ order like unlike common sense. Probability maintained from the start to finish. Use probability sampling, randomization, compare able control, blinding probability of finding of analysis. Hypothesis statement of generated from the interference test for reaching a conclusion about disease causation. Reasoning the process of thinking logically used to make a decision and solve problem. Next is the mile canons of induction. John's short mile, five principles to enhance the certainty of inductive generalization. First one is the method of difference. A factor present in a disease cause but absent in non-cases is likely the cause. For example, lung cancer frequency differ in the smoker versus non-smoker. Second is the method of agreement, a factor common to all cases of disease. For example, hepatitis A linked to the patient contact, crowding, poor sanitation in all outbreaks. Third method of concomitant variation, dose response relationship. For example, increased leukemia frequency with increased radiation exposure. Fourth one is a method of residue. Establish sufficient condition by eliminating the alternative cause using prior experiment or established laws. Fifth one is the method of agreement and difference. Discover necessary and sufficient condition by combining method one and method two. Next we come to the MCQs. MCQ number one, a researcher developed a mathematical model to explain how climate change influences the transmission of dengue fever without collecting field data. The study is best classified as A. Applied research using intervention design, B. Empirical research using observation method, C. Theoretical research using conceptual model, D. Quantitative research using statistical method, E. Qualitative research using narrative analysis. So C is the right. Option theoretical research using conceptual model. MCQ number second, a researcher conduct focus group discussion to the understanding barrier to cervical cancer screening among women. This is primarily a qualitative research exploring the experience, B quantitative research measuring outcome, C applied research testing intervention, D basic research generation theory, E experimental research evaluating efficiency. So B is the right option. MCQ number three, a study collective numerical data from 2000 participants and uses regression analysis to test a hypothesis. This approach is the most characteristic of A, previous research methodology, B, quantitative research methodology, C, ethnographic research methodology, D, phenomenological research methodology, D, ground theory.
B.
Uh, yes. Is the right option. MCQ number five. Which characteristic best distinguish the interpretive paradigm from the positive paradigm? A preference for randomized experiment. C. Reliance on objective measurement. C. Emphasis on multiple reality and meanings. E. Dependence on statistical significance and testing. E. Focus on prediction and explanation. So C is the right option. MCQ number six, which research paradigm is the most strongly associated with social justice, empowerment, and community participation? A. Positivist paradigm of inquiry. B. Biomedical paradigm. C. Experimental paradigm of analysis. D. Transformative paradigm of research, and D. Deductive paradigm of reasoning.
D.
Yeah, D is the right option. MCQ number seven, a community help identify a health problem, assist in a data collection and participation is interpreting finding. The approach best represent A, randomized controlled trial methodology, B, community-based participatory research, C, laboratory-based experimental research, D, retrospective cohort design, E, traditional investigator-led research. So B is the right option. MCQ number eight, a researcher hypothesis that cranberry supplement reduce the recurrent UTI and designed a study to test this hypothesis. This reflects A, inductive reasoning with interpretivist, B, deductive reasoning with positivist, C, abductive reasoning with phenomenology, D, critical reasoning with transformation, E, intuitive reasoning with ethnography. So B is the right option. MCQ number nine, in the comparison of quantitative and qualitative research, the which feature is typically associated with qualitative study? A, numerical outcome measurement. B, large representative sample. C, statistical hypothesis testing. D, rich context specific description. E, strong emphasis on generalizability.
B.
Yes, D is the right option. MCQ number 10, a researcher observed that women from the several urban communities consistently report embarrassment as a barrier to the cervical cancer screening. After after repeated observation, the researcher proposed a new theory explaining screening avoidance. The process primarily represents A, experimental testing of a hypothesis, B, deductive validation of a theory, C, inductive development of a theory, D, statistical confirmation of causality, E, randomized evaluation of an intervention. So C is the right option. This is the answer key. This is the YouTube channel where the video of this presentation will be uploaded. And thank you everyone.